Elkin firefighters and anyone else that might be watching, this is Chief Mike Morton of the Elkin Fire Department, and I am here with you today recording this video so I can show you a brand new feature of our emergency reporting account. It's a very important one for us. Now, it has to do with EMS care. In the past, we haven't had any way of recording patient care information or patient contact information in emergency reporting without potentially violating the privacy of the patient. But now we do. And that method is through patient care reports that are now part of our emergency reporting account. I need to show you, however, how to fill out those PCRs. PCR standing for patient care report. So here I have an incident pulled up. This is a fake incident. Didn't actually happen. All the names and addresses and everything else are inconsequential. So I just want to show you what one of these reports looks like so you can see the differences between how things are configured now versus how they used to be and how to fill out a patient care report. So let's pull up this incident. Now, as you can see, most of this looks the same. We still have a basic module, still have a narrative module, still have a files module, custom, payroll, and authorize. The only thing you see different here is EMS. You get this module because of one checkbox that you complete as you do the report. Let's go to Basic. Basic Info 1 comes up. Everything looks about the same as what we've been doing in the past. No changes here. You still fill this out exactly the same way as you have been. Not only does this not change, most of this up here stays the same as what you've been doing. You still do narratives the same way. You still do payroll the same way. All that stuff stays the same. The only thing that changes a great deal is on Basic Info 2, because now you get an extremely important question here up first. The question reads, first PCR reports are required for this incident. You can see right now it's checked yes. Because it's checked yes, I have an EMS module. If this said no, there would be no EMS module. So this is important, Elkin firefighters. If any of our fire department members conduct patient care or have patient contact while they're on scene at an incident, this needs to be checked yes, and this module needs to be filled out. If none of our firefighters conduct patient care or have patient contact during the incident, then this should be checked no, and that means this will not be here. That's important. Let's go ahead and go to the EMS module. Now, as you can see, I've already got a patient in here. I'm going to show you what the completed patient care report looks like, and then I'll show you how to enter one of your own in. So let's go look at Mr. Jenkins, our patient here. There are 4 portions of the patient care report for each patient that we have. There's a response portion that tells what vehicle responded to this particular man's need, or woman, whatever it may be, what kind of service was requested, what this unit did, what level of care it had. We have a place to collect patient info. We have a place to collect patient care data, such as our initial assessment, the vitals we took, the procedures we did, the medications we administered. And then there's also a narrative section for each individual patient. So this is the way the completed patient care report looks like. Let's go and make a new patient so you can see how the process works. We click on Add New Patient. There are your 4 sections. Starts off with the response. This EMS vehicle number should be the fire department apparatus that responded to the call and that was used to provide care to the patient that we're talking about right here. So in this case, we're going to say that was engine 20. If we have multiple apparatus at this scene, you'd see them all listed out through here, and you'd have to pick the right one. You notice that when you select something in the patient care report, it turns dark gray. If you unselect it, it goes back to light gray. Type of service requested. We're going to assume in this case that we were called by 911 to respond to the scene. So we'll click that. But what if that's not the case? What if, let's say, we went to a fire in CC Camps District and we went there as mutual aid? Well, there you go. primary role of the unit. That's of this unit, Engine 20. In this case, it provided non-transport assistance. We don't do transports here, so you know it's not going to be ground transport, it's not going to be air transport either. So it's one of these three. In this case, non-transport assistance. And then the level of care provided. We don't do specialty critical care, we don't do ALS, we don't do community paramedicine, we don't have intermediates, we don't have AEMTs, so it's always either going to be BLS basic / EMT or BLS first responder / EMR. If only medical responders are on scene providing care, then it's that one. If there is a basic that is providing BLS care, it's going to be that one. Let's go with that. Okay, next section, patient info. This is where enter the information about the individual patient that we're talking about here. And it's divided up into a section with name, age, date of birth, address, and contact info. Contact info and address are not important to us, so do not worry about filling these two out. Only worry about this. So let's say the patient's name was John Doe. John Doe. If you got his middle name, put it in there, or middle initial, either way. Let's say this was a man. Let's say he was 42 years old. And let's say he was white. There you go. Filled out, right? That's all you have to do in this particular section. If it was female, check female instead. If they were black, maybe they're both. Hey, you can check them both. If they're black and Hispanic, there are also other options for race over here. So check whichever ones are the best selection. Let's say the person was white. Okay, it's got a blank here for date of birth. If you've got that, put it in. So I know one of the questions I'm going to get is, what if we did not find out their name? That's okay, because if we didn't find out their name, all we have to do is come over here and select one of these two. Either they refused to give us their name, or we were unable to complete this portion of the report. So let's say we didn't know their name. There you go. Finished. Patient care. Under patient care, we have initial assessment, vitals, procedures, and medications. Initial assessment you can only do once. The rest of these you can enter in as many times as you need to. Maybe you did vitals 14 times. Maybe you did one procedure earlier and somebody else did another procedure later. These three you can enter in as many times as you need to. This only gets it once. Let's go to initial assessment. And let's say that we made our initial assessment right now. Look at there, if we click now, it automatically fills in the date and the time when we did this. Let's change the time. Keep in mind, just like everything else in emergency reporting, this is 24-hour time. So if you meant 4 p.m., you got to put in 1600, like this. If you put in 04:00:00, that's going to think 4 in the morning. Now the initial assessment section has a couple different things going on besides just the time. It has the complaints, the symptoms, and the impressions. Each one gives you a multitude of things you can enter in. Let's say this particular person had a complaint of a cardiac arrest. Well, that was probably their primary complaint. And that's a chest issue. And that would involve their cardiovascular system, right? Maybe that wasn't their only complaint, though. Maybe they also had a stomach ache. Obviously, that would be secondary to cardiac arrest. That would be in the abdomen. And that would be a gastrointestinal issue, possibly. Maybe not necessarily. We're going to assume it is. You'll notice that in order to select something, it has to be darkened in. See how it's darkened under secondary and abdomen and GI? If I no longer have that dark, then I have nothing there. So you got to make sure that whatever you select is dark before you move on. Symptoms. You noticed in complaints, you got to type in whatever you want. In symptoms, you have to pick from what they have. Now, right now, it's only showing 3 up here, but if you go to this arrow, you got all kinds of symptoms that you can put in. So scroll through there and pick the best ones for what was going on with your patient. I'm just going to randomly pick one here. Projectile vomiting. That sounds good. And let's make it their secondary complaint, which means they're going to get another one from me. And we're going to say angina. Oh, no, they don't have angina. Again, you gotta find the best issue you have. Chest pain on breathing. Sure, let's go with that. And that was their primary. You'll notice too, it's not perfect. Sometimes you have to go back and fix things twice. Okay, and down here, we put impressions. So this is where you put down what you think is wrong. I'm just going to randomly pick one here. There you go. When you're done with the initial assessment portion, then you hit done. And look, it records it. It put it in there for you. Now, let's say we did vitals on the person. If somebody did vitals, but we didn't get them, if somebody got them before we got there, then we would say they were obtained prior to this unit's EMS care. Let's say that we got them instead, though. Then, of course, we had to put in a date and time when they were done. So let's say they were done at 16:15. And here's where we put who did them. We're going to say it's me. Under the vitals, you put down whatever position they were in. Let's say they were laying down. Supine. And then you enter in all the vitals that you took. Let's say their heart rate was 74. And it was regular. How do we take it? Well, we got it off the pulse ox. Let's say their BP was 136 over 88. And we got it by listening and using the cuff. Let's say we didn't get to check their respiratory rate. Unable to complete. If we were able to check it, well, even if we didn't check it, maybe we noticed that their respiratory effort was labored. Or maybe it was rapid. Or whatever other option you want to pick. Maybe it was shallow. If we could do carbon monoxide detection, we put it here. That's in the blood. That's not with our multi-gas detector, by the way. If we did pulse oximetry, then we put it in here. Let's say it read 95. If we did blood glucose, we put it in here. Let's say we didn't take it. We'll say we were unable to complete. When you're done filling out the vitals, you hit done. What if you took another set of vitals, though, at 16:20? Well, you'd click this again. And you'd fill out all the same things. 20. I did them. Let's say we had them seated now. The pulse was 102, regular, pulse oximeter. They wouldn't let us do a blood pressure. Sometimes it happens. The respiratory rate was 18 and rapid. But that don't really sound rapid, does it? Let's make it normal. And let's say we didn't check any of the other stuff. So look, now we have 2 sets of vitals on this person. Now if we carried out any kind of procedure, we put the procedure in here. All the different procedures are listed down here. Well, there's plenty of them. So if you did a procedure, put it in there. Same thing with medication. And yes, oxygen is a medication. So fill in all the stuff the same way. Let's go pick oxygen. Actually, let me fill out the other part first. I did it. I'm an EMT basic. It's part of our protocols. I go down and find oxygen. Let's say I gave it to him by non-rebreather. Nah, we'll change it. We'll go nasal cannula. And I gave it to him at 4 liters per minute. There you go. So I didn't enter any procedures in on this one. I did put in a medication, and I put that I did vitals twice. The last part is the narrative. And this is where I enter the narrative of specifically what I did for this individual patient. Now, this is important. These narratives are not the same as our incident narrative. Our incident narrative is the general picture of what we did in that scene. It needs to be nicely written. It needs to be complete sentences. Needs to stay away from abbreviations, so on and so forth. In our patient care narrative, we don't have to be so picky in terms of what we leave out or how we say things. We put in there what we did. We explain what we found. We can use abbreviations as long as everybody will know what they mean. And we try to stay straight and to the point. All that being said, there are also specific things I want you to include in your narrative. And I'm going to go over those in a minute. I'm just going to put some letters in here for now. And we'll say that that's our narrative. Because I want to show you what happens when you complete all 4 of these sections. You come down to summary. And here's everything you've typed in for this particular patient. If it's all correct, then you hit authorize. And you put in your password for emergency reporting. Then you hit authorize. And now, this patient care report is locked. So let's go back to the other patient that we had, Mr. Leroy Jenkins here. And let's go and look at his narrative, because I want you to see the structure of this narrative, and I want you to utilize this type of information whenever you write patient narratives. In this, we include what we were dispatched to and what information we received from dispatch about this patient. Then we put down what the chief complaint was for this patient, not any other patient. Then we put down information about their history. That should include allergies, medications, previous pertinent history, last oral intake, and the events that led up to this most recent incident. We should also include the assessment, what we did to assess the patient's condition, what we found, and what we noticed, what we measured. We should also include what we did to treat them. And we should describe how we transferred care to someone else and what we did after that transfer of care. So for Mr. Jenkins here, you can see I've described what we were dispatched to, what his chief complaint was. I've talked about his history, including allergies, medications, past pertinent history, last oral intake, and events leading up to the incident. I've described how we assessed him. I've described how we treated him. And I've explained that I transferred care to an EMS crew and what I did after that transfer occurred. Do you have to spell it out in individual sections like I did here? No, you don't. But maybe it would help you to make sure you get everything in your report that needs to be there if you do spell it out this way, including dispatch, chief complaint, history, assessment, treatment on scene, and transfer of care. Make sure you cover all those things. Okay, so I'm going to go back to my EMS narrative. I'm going to delete our second patient and say delete. Other than that, everything else in here is the same. Our incident narrative is still the same kind of narrative we've been writing. We still fill out all the rest of this. Everything else gets filled out the same. Then we get to authorize at the end. And everything is the same otherwise. So that's the way that we do these new patient care reports. I'm sure you're going to have questions. If you have some, talk to your senior officers. If they can't answer your question, come see me. EMS providers, this is extremely important for you to understand and to make use of. So start using this effective immediately. Again, if you have any questions, let me know. Thanks.